Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right and left mandibular regions. On the panoramic view, we can see that the ridge is quite significantly resolved, but we will take you through each and every slide so that you can plan the implants accordingly. This is the lower right premolar region, premolar to first molar region. In the first molar region, we've got approximately 3.4 millimeters on the crest of the ridge, whereas we've got approximately 10 millimeters to the inferior alveolar nerve. Moving to the lower right second molar region, the second molar region, we've got very extremely resolved ridge, but here, however, we can tell you've got approximately 5 millimeters of ridge width on the top, whereas we have a rough bone height of 7.5 millimeters. Now moving to the lower left region we've got approximately a 2.9 millimeters at the crest, but if we go slightly deeper, we've got approximately 5 millimeters of ridge width with approximately 8 millimeters of height. And moving to the second molar region, here again we've got very thin bone, but here a shorter implant can also be placed. We've got approximately 4 millimeters of ridge width and approximately 9 millimeters of ridge height. Now we've gone ahead and placed a few implants, which we will now show our doctor. These are the four implants that we've placed. These are all dentist implants. Some of them are shorter, and some of them are of minimum height. Now this is how they've been placed on the panoramic view. We'll take you through each and every slide so that you can clearly see for your ease and comfort. So this is the implant that we have placed on the lower left second molar region. A little bit of bone augmentation on the buccal aspect. If it's done, the implant will have adequate bone support. Moving to the implant, the median implant, which is in the first molar region. Here we have placed a sorry. This is a 4 millimeter and a 4 millimeter diameter and 7 millimeter length. This is for 4 by 7. We've placed a few implants on the lower right side as well. The lower right side, we've got approximately a 3.78 millimeter is going to have sufficient bone support. And if we move on to the second molar region, here it's going to be slightly tight, but if we can place a 6 millimeter height and a polished collar implant, so that would give you 4 millimeters of bone height and a 6 millimeter diameter. So this implant can also be supported, can also support a fixed prosthesis here. We will be sharing an implant planning report. An implant planning report will help with the placement direction. So this is the four implants on the axial section. You can clearly see that all four implants are center of the ridge and have adequate bone support. If we show you coronally, so the coronally you can clearly see each and every implant. There we go. So this is one, this is the second, this is the mesial implant. So they've got good bone support and at the same time will be free from the inferior alveolar nerve. If you have further questions, please feel free to reach to our team. Thank you very much.